Hello, how are you?
I'm pretty good, you?
Good. Fine, thanks. So we're finally finished. It's the new year, 2014, and we got your Invisalign attachments. Everything's done.
Yeah.
Your retainers in place.
Yeah.
So I guess it's been about
18 months.
18 months. That's
18
right. Yeah, a
months.
little bit under 2 years, which is great.
It was really
and,
good.
and your teeth are looking great. And I really appreciate you spending the time to just tell me about your experience and maybe just to talk about what the fears were and how you go about deciding on Invisalign.
Absolutely.
I think you've been a patient of ours since 2005. I was looking at the
Yeah,
file.
quite a while.
So, okay, well, you were telling me a little bit about it earlier, so it'd be good if you can just talk about it a little bit more.
Absolutely. So I always had one tooth that was a little crooked, which was kind of my trademark. So I didn't have a problem with it. But then I got my wisdom teeth pulled out around 2005. And then my whole left side shifted in and it collapsed. At first I didn't notice anything because, it's your mouth. You don't really notice when teeth go and start to move. But then I noticed the pictures and I was like, okay, I started stopping to show my teeth. I would just smile with my mouth closed. I'm like, okay, I don't want to show my teeth anymore. And one of the hygienists here actually had recommended Invisalign to me, and she said that she had it and it worked really well. So I kind of looked into it, and she had recommended you personally, saying you were one of the best in Ottawa. So then I decided, well, you know what? I facilitate a lot. I do a lot of meetings. I don't want any metal, and I really like the idea. Kind of skeptical at first because saying plastic, how does that work?
Yeah.
But yeah, no, it was quite impressive. I got the Invisalign. It was the easiest treatment.
It is easy, right?
Very easy. I got to eat whatever I want.
Yeah.
You don't see them, so which is kind of cool. So.
Yeah. That's the really big advantage over Invisalign, and it's
Definitely.
predictable. We basically start with what you have. Invisalign will give us a view as what your outcome would be, and it's just a matter of wearing your trays. Very committed to wearing it 22 hours a day. That's what you're
Absolutely.
doing, 22 hours a day. Take it out to eat with, and that's it. And that's what the success is based on the patient's commitment.
Absolutely.
And once we have that, then the rest of it is very easy. And it's more, to do with the patient's commitment and how often they wear it.
It truly is, actually, because I followed it to the T, and I know individuals that have Invisalign and they're having a hard time following it. They're like, oh, I don't want to put them on. It's like, well, no, you have to.
Yeah.
If you want your teeth to move and shift and look good after, you have to put your Invisaligns.
Yeah.
I actually liked it because it helped me eat properly and lose weight. So
Yeah,
I
that's
thought that
true.
was
You
pretty cool.
snack a lot less, right?
Oh yeah, the
Well, I'm
chips
wearing
and the
Invisalign.
popcorn kind of stayed.
Yeah,
Only when
exactly.
it was snack time was
That's
allowed.
right. Yeah, that's like me. I mean, once you got it on and you want to go get something to eat, that can wait.
Exactly.
The little snacks can wait. So that is an advantage. But and we like to keep our teeth clean. So of course, keeping it clean and wearing Invisalign really makes everything go well.
It's
and easier.
much easier, yeah. Flossing was easier, brushing was easier, so I like
Yeah, well, those are the big advantages, and sometimes I forget to mention to the patients that there is the oral hygiene part of it that's really makes it facilitates your own
Absolutely.
care and such. So
I know a lot of individuals that have the permanent braces and they have a hard time flossing and their teeth start to yellow a little bit more and I'm
exactly,
like, you know
yeah.
what? I don't have
And the
enough.
lips are all scratched up. They have to
Yeah,
put
yeah.
wax on it.
Yeah.
So I mean, we have patients that need braces because of one reason or another,
Yeah.
and they do complain more about the treatment while it's ongoing. But at the end of the day, the results are basically the same. But as I said, Invisalign I find is a little bit more predictable. I know what the results going to be. Whereas in very conventional braces, we just kind of keep on adjusting until we get the best
Get to the
result.
right one.
So yeah.
No, I really liked it. So
Good.
I'd
Well,
totally do it again.
Yeah, well, thanks again. I really appreciate
No
your
problem. My
your
pleasure.
candid conversation that we have, and and we're gonna see you every 6 months to keep an eye on things.
Absolutely.
Now that you have your retainer, which is a wire that goes on the back of your teeth, that's gonna help hold the teeth, everything in place.
Perfect.
So,
Thank you so much.
thank you. Yeah.
See you.
Appreciate this.